This week on the BackTable podcast.
Maybe it's like your gas tank, right? Maybe we think about it like that. Like you only have so many decisions. Your decision gas tank is only so big. And when you're looking at a yes, no, commitment, do I have enough gas in the tank? And what am I going to say no to, right? I mean, I think that's also the thing is like, if I say yes to this, what am I saying no to? And does it align with the things that I like to do, that I'm good at, that the world needs, and that people are willing to pay for it?
Hello, everyone, and welcome to the BackTable ENT podcast, where we discuss all things ENT. We bring you the best and brightest in our field with a hope that you can take something from our show to your practice. My name is Gopi Shah. I'm a pediatric ENT, and I have a fellow pediatric ENT with me today. I have Dr. Stephen Goudy. He's a professor in the Department of Otolaryngology, Head and Neck Surgery at Emory University in Atlanta, Georgia, where he is the director for Pediatric Otolaryngology. You may remember Dr. Goudy from BackTable ENT episode 20, Complete Cleft Care, where he discusses a comprehensive approach to taking care of children with cleft lip and palate. You may also remember Dr. Goudy on episode 55, Dr. Knows Best, N-O-Z-E, where he describes his journey as CEO and founder of his startup company, Dr. Knows Best. Today, he's here to talk to us about decision fatigue. Welcome to the show, Steve. How are you?
I'm great. I had a lot of decision fatigue this morning about what to wear and what to say.
Well, I'm glad you have the perfect hat on. For any of our listeners, you can check it out on YouTube, but you'll see Dr. Knows Best with the scrub hat on. So it's pretty awesome. So for our listeners who may not know you, can you tell us a little bit about yourself and your practice?
Yeah, so I'm a pediatric ENT or otolaryngologist here at Emory University in Children's Healthcare of Atlanta. I am the director, which means I deal with a lot of decisions and people who've made decisions that may need to be adjusted, or decisions that we have to help other people make to help us. And my life is split into several different buckets, one of which is providing care for patients. And as Gopi mentioned, I take care of patients that have cleft and craniofacial differences. I have a basic and translational research lab that studies ways in which we can regenerate tissues, both soft tissue and hard tissue for patients. And then I have the entrepreneurial side, where I am no longer the CEO of Dr. Knows Best. So big changes in my world. So I made the decision to hire a full-time CEO for the company because that was what was best. So we can talk about that decision. I have another startup company that we're trying to get funding for to develop drug delivery to improve oral wound healing. So I do a couple different things. And
that's a lot of different things.
Each one involves decisions and decision-making. And yeah.
So it's, just to kind of give our audience a background, we were talking and you're like, hey, have you ever done a podcast on decision fatigue? And I was like, no, we haven't. I was like, I get it. I don't know if I really know what it is, but I get it because I feel that way. I get tired of making decisions. Tell me, what is decision fatigue to you, and sort of why do you think why did you want to do the podcast together on it?
Well, number one, I just like talking with you, Gopi.
Me too.
I mean, maybe I like the sound of my own voice. No, so honestly, the topic of decision fatigue, I think we all recognize that, right? It's the end of the day, particularly for clinicians, surgeons, et cetera. You're like, I am worn out. My brain is tired. I'm a little bit grouchy. And here we are, right? And trying to make those decisions that are potentially important to people's health, wellness, and or living, dying, et cetera, is something that I hadn't thought a lot. I mean, intrinsically, we know that it's harder at the end of the day than in the beginning of the day, but this really came, I guess, in the backdrop of burnout, right? So people right now, today, tomorrow, next week, everybody's feeling a little frustrated and burned out. And, decision fatigue adds to burnout And so we, as a group, we're talking about how all of the things that surround us really get us tired and frustrated, and we can't focus on the right things to make the most important decisions that only we can make, right? So working top of scope, I shouldn't decide what color sheets are on my bed. I shouldn't decide, what color the house should be, because it's not that, there's a lot of people that make the decision, and number one, my input is not needed most of the time on those kinds of things. So it's really honestly in the backdrop of burnout and kind of how do we keep people in their happy zone of like where they should be playing and not making them make decisions that other people should have already done that are just frustrating. And then when it comes to those important decisions, do I cut the nerve? Do I save the nerve? They're out of gas.
Yeah, I think you make a lot of different really good points about timing, how it makes us feel, where our energies need to be with the important decisions, whether it's a critical point in a case or whether to offer surgery or not. How do you feel about, the decision fatigue isn't from only having to make a lot of difficult decisions, which is part of patient care. But it's a lot of, and you alluded to the, color of the sheets on your bed that day. It's a lot of decisions that aren't, quote, critical, difficult decisions. A lot of these are just day to day. How do you sort of know what to kind of parse out or keep lean, if you will, and the input that you have to, allow to your brain to have to make those decisions?
How should I or how do I?
How do you? And then you can tell me how should you, if there is a should. There may not be a should.
Yeah. Oh, no, there's definitely a should. I mean, there's lots of data around this. I mean, it's not just the medical profession, right? I mean, if you, like most of what we apply to the medical profession as it relates to safety, quality, so on, is driven from other industries, particularly the airline industry. And so if you look at a lot of the rules that have been put in place as it relates to fatigue, right? And decision fatigue is just a part of fatigue. You don't want your pilot to have decision fatigue, right? Because she or he, that needs to be on point. I mean, there's no margin of error, right? And certainly surgery and medicine is very similar. So there's a lot of shoulds, right? But how do I do it? I mean, there's some simple things, right? Like if you look at Steve Jobs, how many outfits did he have? One. Yes. So he wore the same thing every day because he didn't want to spend any of his, and again, I don't know. I mean, I assume that this is the reason, but he didn't want to spend any of his mental energy thinking about what to wear, right? So like simple hacks or tricks is like, I'll lay out my clothes the night before because I don't even want to think about it. I mean, I'm always running late anyway, but that's not a decision that I want to invest any mental energy because you have a finite amount of focus, finite amount of, 200 decisions, 300 decisions you're going to make in a single day that are going to be really good. So that's kind of the simple stuff. Ideally, like for me to be creative and to make good decisions, I steal from the front of the day. So just honestly, particularly on the weekends, the weekdays are just, destroyed with this and that committee meeting at 6 a.m. and so on. However, on the weekends, I'll get up early, 6 a.m. It's quiet. Put the, Premier League in the background, no sound on, and then I can focus and create space where I could be creative, make good decisions, and so on. As far as important meetings, I try not to have those at the end of the day if I can avoid that, because I think that, and it's not just for me, it's for everybody. That is people are out of gas and it's really hard to do. However, it's also not popular to have a 5 a.m. meeting, with a bunch of people. So in healthcare, we really run against that fatigue. I mean, we are not in a space where we can have, the lunch yoga meetings or whatever don't work as well for us. So those are just a couple of the things that I do, like the hacks that I have or that I've learned about myself.
No, that's super interesting. And the morning, I think, is important. Earlier in the day, you haven't had as many decisions to have had, you haven't been bombarded, if you will, with that, having had that many decisions to have made. Maybe you had breakfast, you have a little bit more energy, you just woke up, so hopefully you're a little bit more awake. When we decided to do this topic, I was like, I need to do some reading because I really don't know. Like, I know what happened. Like, I know what it feels like because when you said it, I'm like, yeah, I get it, but I don't know how to really think about it or talk about it in terms of what's out there. And one of the things that came across, though, which I found was so interesting, was there was a study in 2012 that looked at 1,000 judges. And they found that if you were a prisoner who went up for parole, 65% of the prisoners got parole in the morning. But towards a later, part of the day or the session, if you will, right before lunch, only 15% of prisoners got parole. And talk about having to make decisions. And earlier, you would think earlier on, you're being able to think through each person's case and, decide whether or not this person should get parole or not. And by the end of the day, that article talks about how, well, you end up just kind of doing what's safe and what you're used to. This direct, what they call a mental shortcut. Like, well, the safest thing is just prison, to take the chance. I don't know right now. I can't even put that into place. And, based off of that, there was also other studies looking at, primary care physicians prescribing antibiotics. The later the day went on, the more the antibiotics were, like, here you go. So I think you're right. There is that sort of time of day temporal part that plays a role as well as eating. And we have to make those decisions, not necessarily whether you give parole or not, but it's the same thing of whether you decide to do surgery or, how every person that comes in with an abscess, we usually okay, and IV antibiotics, but maybe there's something else going on with this kid that's beyond that. It might change the protocol a little bit. Do you find that in your clinic mornings, do you ever notice that when you're practicing, that by the end of the day, less people are getting surgery or maybe the discussions are a little bit different?
So I would say there's a couple of things here to unpack. One is, as you said, there's certain things that become mental shortcuts, right? And so I'm an older person now. I've been in practice almost 20 years. And so I built up a bank of those shortcuts, right? There's a saying that the neurons that fire together wire together, right? So if you wired all those little neurons together, I mean, I can be talking to somebody about a tonsillectomy or ear tubes or whatever, and it's not occupying a lot of mental space. It's just like my mouth is going, I'm typing, and certainly that is more reflexive. However, if you're new, meaning like you just graduated or whatever, I mean, all of this is new. You don't have those mental shortcuts. So the decision fatigue early in your career, on top of the imposter syndrome, on top of maybe having young children at home and not getting enough sleep and not eating well, not exercising, like all of that is a recipe for challenge. I will say in the afternoon, to me, like I have a lot of mental shortcuts and it's really about pattern recognition a lot of times with patients. So I don't have difficulty in the afternoon necessarily making decisions. What it does cause issues is like if there's other things going on concurrently, like, okay, I got to get to a meeting, so I got to like hurry up. Or there's like a backdrop of other chaos that's unfolding in the practice that's occupying, like I'm making decisions about 2 or 3 things simultaneously. And that's where I noticed that the ability, I mean, they say your brain can only think about one thing at a time. Like my decision making is impacted by that.
Yeah. It's funny you say that early in your career, everything is kind of, you don't have the mental shortcuts because you're just trying to get your practice. I remember early on, like, my division chief at that time was Ron Mitchell, and he'd have 20, 25 patients in a morning session. And for me to get through that for the whole day, I'd be exhausted. And I'm like, I didn't even think that, hey, this is somebody that's, this is just part of it for them. And it's because I just haven't maybe built that up yet, and how that sort of just the initial, when you're making these decisions and you haven't done it over and over yet, maybe even the number of reps in a similar setting helps create those shortcuts. And sometimes they can be helpful. Tell me a little bit about, you mentioned all of a sudden, sometimes not all of a sudden, but for you, especially with all the different hats you wear, there can be lots of different things at the same time. So there's things that you can control, right? Like, okay, fine, you lay your clothes out. Okay, fine, I have a smoothie in the morning. Okay, fine, there's things that I can control, but there's a lot of things I can't control. But the floodgates, like, right, they can't just always be completely open. Or how do you manage that?
Yeah, I guess it a lot of it depends, right? So again, it is super important to get enough sleep. Like my base number, 6 hours and 45 minutes. We all sleep in 45-minute increments in general. So, you need to hack as many things as you can so that and make sure that your mental health, your physical health, to the best of your ability, is dialed in so that you're prepared. I think, some of it's just making mistakes, right? I think that is one way to learn and understand and be human and know that you're going to do it. It's the same way, as I tell all of our faculties, the only way to avoid complications is to not operate, right? And so the same thing with making decisions. The only way to avoid, making the wrong decision is just making no decisions. Although making no decisions is still a decision. But having an ongoing list of priorities that you have to attend to, and being able to delegate effectively, meaning surrounding yourself, building people up around you that are capable, that you're not micromanaging, and that you can give clear instructions to in a way that they understand it, I think is important, and it's a constant shuffling of cards and priorities, because, the lab may reach out and they're having a crisis, or the clinic and the OR always have a crisis. The same reason I hired as a full-time CEO for Doctor Knows Best. Certainly, is there a trade-off in saying I am not going to be the CEO anymore? Absolutely. However, hiring somebody to tend to a successful thing to make it more successful, and letting go of some of the control is hugely important. So, yeah, I think those are some of the things. And I have ongoing coaching. So I have a coach that I've talked to for the last 9 years, and I surround myself with people that I trust. I invest in them. We use the Berkman personality test to all understand each other's strengths and, weaknesses and what have you. So we can have very honest conversations about which lane belongs to whom, because they're good at it and they like to do it. I think all of those are ways that you can set yourself up to be effective and grow people's careers around you.
Yeah. No, that's really awesome, because it includes team building, it includes communication, understanding what your priorities are and your values, like honesty. So I think that's really helpful, and that's really important. And it's almost that, it takes some self-reflection, right, with coaching, and kind of thinking about what's important, what are your priorities. It takes some time to kind of do that, so that when these decisions come up, you have that to kind of fall back on, right? Like on what your values are and what your priorities are. And it's something that I don't think that I really appreciated until, honestly, about a couple of years ago, not even, in terms of how important it is to take a second to kind of just what's important, what are my values, and kind of taking time to do that. Because I think I got to such a point where I was just like overwhelmed with constant, quote, things coming at me, but not really knowing, just kind of swimming, kind of trying to survive, but not really knowing how to manage myself or, those situations in a way that was effective, or in a way that was like, true for me, or, valuable to me. You had sent 2 articles, which I thought were really interesting. One was looking at decision-making in an orthopedic clinic out of Sweden, which I thought was really cool. And the other one was looking at surgeons operating in Germany at 2 university hospitals. And I wanted to touch on those because I thought they were, in terms of decision fatigue as surgeons, what are the 2 arenas, right? We're in clinic or we're in the OR usually. And so how does it kind of play out there? And the Swedish article was super interesting because they looked at 8 orthopedic surgeons. I forget, I want to say about 400 clinic shifts, or what they called clinic sessions, or what they called work shifts. And they basically looked at, their hypothesis was that the earlier you came in to clinic, the more likely you would get surgery. And the later your appointment was, or when you were seen, the less likely you would get surgery. And the crazy part, so their clinic sessions would have anywhere between the range was 1 and 9 patients per session. And so an average was about 6. But the first patient that came in, they found had a 42% chance of getting surgery. And the 6th patient that came in, a 21% chance of getting surgery. And the 9th patient, like a 7% chance of surgery. So that ordinal place, like where you were in the clinic session, made a difference. And then after lunch, the percentages went back up again. And so it just made me think about how many times do we properly sit down and eat and step away. And I would tell you on for me, especially like 5 years ago, I would just kind of keep working. I've got to get my notes done. Like I maybe had like a power bar or whatever, and you're just kind of cruising through and, oh, it's already 1 o'clock. Great. We got another, 15, 20 to go. And you're just kind of moving and grooving. And now I'm a little bit more cognizant about, you know what? I need about 10 minutes. I'm going to go grab some food and find something that I actually want to eat and like kind of fuel up. Tell me about, how we structure, what are your thoughts on how we structure clinic and sort of how you do clinic, just to kind of avoid that sort of fatigue?
That's the magic question. I would say that what I do probably isn't what is the best thing to do, just because I have a lot of mental shortcuts now and I can recognize patterns, measure the time. What you described as taking kind of these little micro breaks, I think is very important for people. Our healthcare here in the United States is not organized in a way where that is really thought of, even as an afterthought. So if you are creating a clinic schedule, there are not breaks that are incorporated into that for many reasons, right? So I think making sure that the clinic is set up in a way in which you're only being asked to make decisions that you're only capable of making, right? It's not like, oh, well, where are the tongue blades? Well, where is my assistant? Where, like, all of those things that are complete distractions and frustrations that get you out of that like pattern recognition moment are preventable. And as an example, we have walkie-talkies in our clinics. We have, standardized placement of tongue blades and ear curettes and headlights and so on, so that I want you in the tunnel, in the zone with the patient. We have scribes now. So, we're looking at the patient, we're kind of working in the chart, whatever. And we're not like trying to go back and forth and like, oh, did I write that down? What is the scribble, whatever. I think those are all, because that's also friction, friction meaning frustration and kind of slowness. And you're making decisions around how to avoid the friction or manage the friction versus making decisions around, do I order a test? Do I order surgery? Do I cut the nerve? Do I cut the artery? What margins do I need to get? I mean, those are the decisions that we should be making and no other decisions. And so it's hard. I mean, clinic can be a beast. And so that I would say one of the things that I'm going to say this and sound old, but the younger generation, or any generation probably doesn't understand is the idea of continual process improvement. In that, we're always going to be working to make things better. And if we made things 1% better every day or every week, at the end of the year, we would either be 50% or 300% better. And so identifying those small incremental things that you can reduce the distractions, reduce the friction, avoid having to make decisions just because your brain already knows, okay, the tongue blades are here, or the nurse is right behind me, or the scribe is taking this down, reduces the number of decisions you have to make, right?
Yeah. No, that's super helpful. And then, when we talk about going in the OR, with the study you'd sent out of Germany, looked at, I think it was general surgeons and ortho trauma surgeons, and they looked at over 50 cases, and they were like about an hour and a half long or so. And they had, two observers, using a validated scale to look at interruptions. And then they had the surgeon as well as the anesthesiologist and the OR nurse fill out surveys about mental fatigue, workload. Did this make you tired? Did this make you anxious? Et cetera. And I think it's a survey that they also use. It came off of what they used in NASA. And what they found that was super interesting is, they had about 10 distractions per case. So in a 90-minute case, it's about like every 6-7 minutes. And most of the time it was pagers, cell phones, or people coming in and out of the OR, which we're all used to. But what I think that they also found interesting is this sort of, some mental breaks or some distractions are actually good. And, where it hurts us is where you have that plus actual interruptions in the procedure, like equipment, the camera's not working, such and such doesn't plug in, the light's not on, the scope is cracked, right? How many times have we been there and it's just like, those things add up. Tell me what your thoughts are in terms of OR as well as, hey, sometimes these distractions are good. Sometimes in clinic, having a laugh with my patient or with the staff is okay. Like, tell me what your thoughts are on that.
Yeah, I think it's all relative to your situation that day, your underlying personality, how long you've been in practice. I think there's a lot of factors that go into that. I would say in general, I don't think that distractions are helpful for the most part. I think that we all would know. So I can't
ask you about your vacation on a ear tube tonsil day?
Yeah, I think that's fine, right? But like when I'm teaching residents, they start talking and operating. I'm like, look, you get to choose. You can either talk or operate, but you're not at the point in your career. You don't have that ability, those mental shortcuts to do that, right? And getting back to like just the very basics, like, hey, if that's my kid on the table, I want 100% focus, right? And that doesn't mean that you can't talk and work and so on. However, you need to be prepared as much as you can for that case, for that surgery, so that, and that's not really just you going in and doing that. That should be the hospital, the OR. It's like the old movies where you just kind of walk in the door and hold your hands up and, off to work you go. It's not, a lot of times you're trying to, okay, well, we don't have this instrument. What do you want to use? Like,
I need a Bowie. I need suction.
Yeah, right. But, that's the crazy thing is like you've spent so much time and energy getting to just to do the surgery. You're gassed and you're frustrated, and maybe it is what you said. You go sit down and take a break and, recharge or get centered or whatever it is so that you can go in and make those good decisions, right? You almost have to reset the button to some degree. And that's why, like, getting back to what the question you asked me earlier is like, how as a director of a division, what are your roles and what are you going to do? As it relates to decision fatigue is like, we need to standardize things, for us, for the operating room. We now have 12 partners and we can't have, 12 different ways of doing things because that drives everybody crazy. And when you walk into the OR, it should be prepared in a similar way so that you can just show up and do your job. How many times do you sit down to put in ear tubes and the person sitting across from you doesn't know how to load them? And that is a complete drag, and you're like, this is really frustrating to me.
I have to take my eyes away off the microscope. I have to reset my hands, load it, hand it to them or lay it down. And then I have to readjust the speculum in the microscope so I have my view again. And then I might have to suction because there's probably a little blood or drainage or whatever. And then it's like, okay.
Yeah. How many decisions do you think you made then? Probably 8. I counted about 7 or 8.
Right.
Okay.
Right.
And that's the thing, right? It's like, okay, if you have 200 or 300 good decisions, maybe in a day, and you have a half day of tubes and tonsils and then a big 4-hour case at the end of the day, you may only have 50 good decisions left for a 4-hour case.
And you better have a handful left for when you go home.
Good. That's a
right?
great point. That is a great point.
I mean,
yeah.
like, I just remember, especially my kids are 10 and 12 now, and I need to have energy when I go home. But when they were little, I loved bath and bedtime, but I would be so exhausted. I'd be so tired, and they want to run and me to chase them. And physically, I was exhausted from the day. Mentally, trying to coax them back into the bathtub, I was exhausted. And then it does lead to fatigue and avoidance. Like, I remember there was one time I wasn't quite ready to go home yet. Like, I had a long day, and it was about 5:45 in the evening. So not super late, but it was long. And I just sat in my car for about 20 minutes before I went home. I just was not ready to go home. And one of my colleagues, he's a craniofacial, he knocks me on. He's like, "Are you okay?" And I'm like, "Yeah, I'm not ready to go home. I'm just watching something on my phone." I'm like, "You should try it," because we forget that we still have to have some fuel and that ability to engage when we go home. And so it all kind of spills over. And it can, for me, I get avoidant. I can become, once I get to that sort of decision fatigue, like, "Why are you asking me this?" I get a little avoidant, or I might, hesitate to engage or make a decision. I may not take a second. And really, it takes a second to kind of think through, or I might just be like, "Yeah, well, we always do this, right?" Like, which isn't always the pattern recognition that matches what maybe the patient or my own kid might need. And so it's hard because it spills over into many different of our domains in our lives. And you mentioned this in the beginning, is that it can lead to burnout and fatigue, and the sort of sense of kind of, I don't know if loss is the right word or what the right word is, but and then it goes back to, well, what do I need? What's important to me? And taking that second to, what's the why? And then kind of making that habit, so that if that question comes up, like, "Oh yeah, okay, like, this is how I honestly feel about it." It's like, honesty is your value set. Okay, part of it. But so as we kind of, start to think about ways to, manage it, and you've hit on so many different things in terms of thinking of small things to improve, to decrease friction in the process, whether it's at clinic or in the OR, to standardize things. You talked about building a team, communicating, having your priorities, taking time for yourself, which includes coaching, which includes reflection, understanding who you are, what your values are. What other, in your experience, whether it's on the entrepreneurial side, on the basic science side, clinical side, on your family side, do you feel has anything else that would help us out?
Yeah, a couple things. One, I was, in preparing for this, I ran across an article where Bill Gates is talking about the best thing he learned from Warren Buffett, and obviously very successful people. Apparently Warren Buffett says no to almost everything and creates tons of space for himself to think and be creative and do things that make sense to him. And certainly most of the people listening to this podcast that are in medicine, that's just not possible. Having said that, what I recognized after reading that, I started looking at my calendar. I'm like, dude, my personal goal is to evaporate every minute that I have and not have any time carved out to think, to be creative, be with my family. So I would suggest to people that carving out time for you to think and be creative is important, as well as with your family, right? Because one of the things you mentioned is, like, when you get home, you're gassed, and that may be the only time that you can see your significant other, and he or she is asking you important questions or updating you on things that really matter. And you're like, "Look, whatever you want to do, dear." That's not the right answer. That does not show respect or engagement or what have you. However, where is the time that you're going to get together and talk and solve about what's best for your children, what's best for your future, if there's major life events or health events. And sadly, a lot of us don't really do that until something really big happens to us. And it's the same for me. So I would just say that that's something that I don't currently do that I need to do. I need to do that. I need to create that space. And I need, as a leader, I demonstrate what I think other people should do tacitly, and if I don't demonstrate that finding a balanced approach is important, that's a problem. So the other thing I would say as we were thinking about things here is really thinking about the term ikigai. And I know that you and I have talked about that a little bit. It's a Japanese term. I'd say many people probably heard it, but they found it in these blue zones, particularly in Japan, where people have longevity because they align what they're good at doing, what the world needs, what makes them happy, and what people are willing to pay for. And really just saying and using that kind of lens or some lens therein to make decisions about what you do and don't do, right? So again, going back to Warren Buffett, you can think whatever you want about him. He says no to a lot of things, right? And so if you are making decisions, it's easy. My chair said, you live with your yeses a lot longer than you live with your nos, right? And so making and agreeing to doing something or not is a decision, right? And if you think about it, it's like if you say yes, there's 1,000 more decisions that are coming thereafter. Whereas if you say no, you didn't add a bunch of decisions to your life. So maybe it's like your gas tank, right? Maybe we think about it like that. Like you only have so many decisions. Your decision gas tank is only so big. And when you're looking at a yes, no, commitment, do I have enough gas in the tank? And what am I going to say no to? Right? I mean, I think that's also the thing is like, if I say yes to this, what am I saying no to? And does it align with the things that I like to do, that I'm good at, that the world needs, and that people are willing to pay for? And the pay for part, can be very broadly interpreted. But, and this is just me kind of figuring out these things randomly, whereas I would hope that others are being mentored, coached, developed to think about this earlier in their career so that there's less potential burnout, that there's more enjoyment. I would say the next generation is much better than my generation or your generation, saying, man, this seems like kind of shitty. I'm not doing that. You guys are dumb. Like, why would you, why are you so masochistic? And
right.
Do you see a problem with that? And I'm like, well, now that you point that out, it seems to be, seems to be dumb.
Well, that's super well put, Steve. It's like, it's okay to say no. B, if I say no to something I really am not sure I want to do, it allows me to say yes to when the opportunity is there for something I actually want to do. I'm not already doing a bunch of things I'm like half about. It's like, yes, there's other things out there. And I think having that top down is huge because it sets the tone, it sets the culture. But I want to thank you so much for coming on and suggesting this topic. I learned a ton, and I felt like I had to really prepare and like really think about it, because I'm like, again, it's like, I know what it is, but like, it's something that I think we all have to kind of work through and kind of think about and, take a second. So thank you so much. If our listeners want to reach out to you, Steve, can you tell us how, if you're on social media? And yes,
you can follow me on TikTok at Dr. Knows Best. You can follow me or reach out to me on LinkedIn, Stephen Goudy, Goudy. You can reach out to me at Emory. Just find me if you need, if you want to talk about ikigai, decision fatigue, lots of mistakes I've made. Happy to share all those.
Well, thank you so much. And for our listeners, thank you for stopping by. I think it's a wrap. Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend. If you have any questions or comments, direct message us at _BackTable ENT on Instagram, LinkedIn, or Twitter. BackTable ENT is hosted by Gopi Shah
and Ashley Agan.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter,
Aaron Bowles, Nick Shellcross,
Josh Spencer.
Design and digital marketing led by Brian Schmitz, with support from
Taylor's Version Hess.
Social media and PR by Chi Ding.
Administrative support provided by Jamila Kennebrew.
Thanks again for listening, and see you next week.